Hi, it's Susan and Dr. Wages from North Shore Plastic Surgery and Med Spa, and today we wanted to talk to you about fat removal. Dr. Wages, I see so many commercials about stubborn fat removal. Some of it heats fat, some of it cools fat. I'd like to know more about what we offer for Safe Lipo, because that's a more immediate and permanent way of removing fat. Talk a little bit about the Safe Lipo that you do.
Absolutely, and I agree with you. I'm confused when I hear that stuff because I've been trained in doing this for over 20 years. Some of the offers and the implications are that this is easy to do. I will assure you there are some people that have a very easy way to remove fat no matter what technique you use. But there is an art and a science to it. For most patients, removal of stubborn fat isn't easy. And I share with the patients their difficulty in trying to lose it with diet and exercise, and that's the ideal candidate for liposuction. And the other question I get is, what's the difference between laser liposuction, ultrasound liposuction, power liposuction, tumescent liposuction, and which one is the best? Which one is best is the one that your surgeon wants to use. So it's a technique that is more of the hands that are doing it than the actual machine. There's no machine that's going to do liposuction without somebody using it. And so having a surgeon who's very skilled and has an artistic eye is the most crucial point. And you can give a skilled surgeon any instrument and they can deliver a result. They can deliver the result they're most comfortable using with the tool that they like to use. For me personally, I like to use the traditional liposuction. I have used laser liposuction, I've used ultrasonic liposuction, I've used the power liposuction. All those terms, there's been no scientific study that would show that any one of those presents a better outcome. The best outcome is in the hands of the artist and the surgeon who's doing the treatment.
Well, you say artist too, because I see the patients that come in here, and I can attest to the fact that you it's almost like carving the skin. Like you leave people very smooth. I think a lot of people don't understand that the technique is so important in terms of the outcome. Talk a little bit about Safe Lipo, what that means.
So Safe Lipo means taking care of a patient. I mean, this is about having an approach that allows you to have a safe outcome. I mean, nobody wants to look good and not have a great result. Nobody wants to have contour irregularities. And so the way that happens is by, with the Safe Lipo technique, is infiltration of tumescent fluid, giving that time to actually work so it reduces bruising, reduces excessive swelling, and then removal or separation of the fat so that you can remove the stubborn areas easier. There are some fat that is very stubborn and hard to remove, and other fat that wants to go very quickly. And if you don't pre-treat those areas, when you're going in with any machine, whether it's a laser or ultrasonic machine, the fat that wants to come out easy will come out quickly, and then you could be left with a large divot that you don't want. So without any suction going on, I'm separating all those tissues. And then once I've separated it all the way I want to separate it, then I aspirate it. And then after aspirating, I come back and I kind of feather the contours of where we wanted to stop to where we didn't touch it so that it's all smooth and even. And then if I need to, kind of equalize any areas that have some irregularities. So that's what the SAFE, S-A-F-E stands for: separation, aspiration, feathering out, and equalization. And it takes attention to detail. So you have to not be in a hurry and, oh, I went in and had surgery in this doctor's office and it took 20 minutes and it was just under local anesthesia and I was texting my friends. More than likely that person didn't really get a good outcome. There's no way you can deliver that kind of outcome with that kind of attention.
And when I see some of the commercials and you look under the fine print, it says results not typical. When you see the patient that went from a size 20 to a 4, I think that it's important for patients to have realistic expectations. And I know that when you do a consultation, that's part of the consultation that you do when you're talking about liposuction, correct?
Absolutely. You can't just advertise, 2 areas, $1,500, or 3 areas, because there are some people, one area is the most you can do because there's limits to what you can do safely. How much volume you take out safely. There are people who have died because somebody was overzealous and took out everything that they wanted to take out, and at the end of the day they had toxicity from the medications and excessive blood loss, and it left to the demise. So you can't just quote this much for each area, because it really depends on how much each area is. And there's times where I see a patient, I say, you know what, I think you would get a great result. However, we need to do the tummy in one section, we need to do the back in another session, and then the thighs in a separate session, so that it can be safe and you can be happy with your results. And depending on how much we're doing, anywhere from 6 weeks to 12 weeks between each session to really get a great outcomes that you can be happy.
Well, this has been really informative. Thank you so much for talking about safe lipo, and I hope that those of you who are watching, if you have any questions, call us. If you want to get a consultation, we can help you with removing some of that stubborn fat.
Thanks for watching.